Hi, this presentation is for the Proactive Prenatal Parish Program, which is in partnership with the Louisiana Department of Public Health and will focus on Cato Parish in Louisiana. Our communication team consists of Becky Annunzio, Morgan LaPrete, Liliana Pedro, and Mary Prim. So the health issue is that congenital syphilis cases in the United States are on the rise for the 5th year in a row, and the rates in Louisiana are amongst the highest in the nation. According to the Louisiana Department of Public Health, timely testing for STIs was not always occurring at the prescribed pregnancy testing intervals, as specified by the state law, thus contributing to a significant percentage of congenital syphilis cases. Congenital syphilis is almost completely preventable if maternal testing for syphilis occurs and treatment is started rapidly. The recommendation for this campaign is to assist the Louisiana Department of Public Health in decreasing the number of missed testing opportunities by both promoting awareness for the prevalence of congenital syphilis cases in Louisiana, as well as promoting the importance for medical providers to be adherent to the state STI testing laws in order to combat the growing public health crisis. The Louisiana Health District with the highest number of congenital syphilis cases is District 7, Cato Parish, and will be the pilot for this campaign. Focusing the campaign in this region is strategic in that it places the communication in the thick of the missed opportunities for timely testing. The health issue in question is congenital syphilis, specifically Cato Parish, Louisiana. Congenital syphilis is a disease that affects babies born from mothers who have syphilis during pregnancy. The issue is that as of 2019, there are almost 50 cases of congenital syphilis per 100,000 live births. In Louisiana specifically, the congenital syphilis cases ranked 3rd in the US. The case rate in Louisiana was over 70 cases per 100,000 live births. According to the 2018 STD surveillance report from the Louisiana Department of Public Health, cases of congenital syphilis occurred most often in women under 30 years of age and disproportionately affected those in the Black community. The overall mission of the program is to reduce the number of congenital syphilis cases in Cato Parish, Louisiana. For this to be accomplished, our team created a communication prototype that covers primary and secondary audiences, implementation, a communication plan, and the evaluation plan that will lead to the long-term outcome, which is to reduce the adverse health outcomes for mother and fetus in Cato Parish. We have targeted 2 audiences. The primary audience is the medical providers, and the secondary audience is the mothers. The first goal is to expand healthcare provider knowledge about STI screening through continuing education, seminars and certifications, and that will include providing resources, incentives, and training for healthcare professionals. An additional goal is improved patient knowledge, increased and expedited coverage and testing for mother and partner testing. The goals and objectives will be met through our comprehensive communication plan. The communication plan includes reaching providers and the mothers. Immediately, we will target all medical providers with the Dear Colleague letter segment of the communication campaign. The Dear Colleague letter will be alerting the medical community of the prevalence of syphilis diagnosis, as well as the perinatal transmission rate and the broadly missed opportunities for testing. It should remind the medical community of the testing laws, as well as educate the community about the fact that congenital syphilis is to be considered a sentinel event. The letter will also provide information about upcoming continuing education, training, and seminars that will be hosted. To target the primary audience, medical providers will receive a Dear Colleague letter and a complimentary campaign button to wear to encourage patients to ask about the campaign and to encourage other providers to get on board. The second immediate action will be part of the proactive prenatal parish communication segment of the campaign. Mothers will sign a proactive prenatal parish pledge, asking them to commit to future testing and timely prenatal visits, open communication about congenital syphilis with their providers, and increase communication with their partners and friends about congenital syphilis prevention, treatment, and the effects. This will be achieved at community events and support groups. The final intermediate goal will be to increase visibility and communication about congenital syphilis within the Cato Parish community. The campaign will utilize proactive prenatal parish members to speak at community centers, community events, religious centers, and targeted support groups. To target the secondary audience, mothers-to-be will receive save the date info session flyers via their patient portal and via infographic one-pagers in parish clinics, waiting rooms, community centers, and poster placement in clinic hallways and exam rooms. Overall success of the program will be measured by the reduction in the number of syphilis cases recorded in Cato Parish each year. We will accomplish this by analyzing the qualitative and quantitative data we received during the program implementation. The qualitative data will come in the form of surveys from the mothers as well as healthcare providers. The surveys will seek to determine information such as if the program reached the intended audience, and if the audiences felt the program was useful and accessible. Quantitative data will be collected from the Louisiana Department of Public Health regarding the cases recorded. The results will then undergo a process evaluation as the program is new and is still establishing roots in the community. We thank you all so much for listening to our presentation, and we would like to especially thank Dr. Rogers for her support on our communication prototype and equipping us with the knowledge needed to create it.